Joining. Just for any of you who don't know, my name is Jane Meadus, obviously, from the Advocacy Centre for the Elderly. And I'm one of the lawyers there along with Alyssa, and we are the institutional advocates. So we spend all of our time dealing with issues of long-term care, hospital discharge, and some other institutional issues. Now, the one thing I will say, I know we're going to have a question and answer at the end. Please make it a general question. We cannot provide legal advice. We can only provide legal information, and we'll do the best we can. And if it veers to advice, we'll tell you that. So we can't hear the story of your, great aunt who lives in long-term care. But if you have a specific question about how the rules work, please try to put the question in a very specific question. So we're going to go through a number of different things with respect to sort of what the landscape is around the law, what the visitors' rules are and restrictions, and then a little bit at the end, a little bit about absences, because that's sort of become an issue over time.
So Natalie, just a heads up, we're on about slide 3.
4. Go to slide 4. Thanks. So,
is that right?
Yep.
Sorry. Okay.
We are going to be specifically talking about long-term care homes today, not retirement homes, but we did want to make sure that people understood the difference. So basically, a long-term care home is a publicly funded long-term care home. It can be owned by a municipality, a for-profit corporation, not-for-profit or charitable, but it is governed by the Long-Term Care Homes Act. All of the care in it is provided by the Ministry of Long-Term Care. The rates in the long-term care homes are specific to the are specified in the Act. And that's the one where inspectors come in from the Ministry of Health and do the inspections and all that sort of thing. When it comes to retirement homes are tenancies. They're not health facilities. You pay privately. It's all contract based. They're licensed through the Retirement Home Regulatory Authority. They're governed by both the Residential Tenancies Act and Retirement Homes Act. But one of the pieces of confusion is that for whatever reason, the government decided to lump them together when it comes to COVID. So the rules such as Directive number 3 normally would not apply to a retirement home, but they passed special regulations so that retirement homes and long-term care homes are basically treated the same. Although when it comes to visitors and absences, they're treated differently. So that's why we're not specifically talking about that today, because they are different rules. So we're going to be specifically focusing on long-term care. Next slide. And we will make these slides available, by the way, to Natalie to either post or send out later. So in case you're just like going crazy writing down, we will provide them. So there's a bunch of different legislation you need to know during COVID. Some very general stuff would be Long-Term Care Homes Act, the Healthcare Consent Act, which deals with treatment issues, Substitute Decisions Act that deals with guardianships and powers of attorney, Personal Health Information Protection Act, dealing with access to information and records, the Health Protection and Promotion Act that deals with orders of the medical officers as well as the directives, and then the Emergency Management and Civil Protection Act, which deals with any kind of emergency orders such as occurred yesterday. Next slide. There are many regulations that are passed as well, which relate to those pieces of legislation. And you'd have to look at the different pieces of legislation to see what regulations may be passed, and those can be changed quite quickly. So the regulations can be ongoing. The legislation requires a vote in the House, but regulations are just done by the government. Next slide. There are also federal legislation which deals with COVID, and the specific legislation would mostly be the Quarantine Act and the Aeronautic Act, and they have to do with international travel. Next. So then within the province, we also have different orders. And so orders can be done, and those can be legally enforced. And so the Minister of Health has orders. The Minister of Long-Term Care also has an order, although it's not, it apparently isn't available on the website yet. The Minister of Health orders have to do with the supply of PPE. The Chief Medical Officer of Health can do Section 22 orders. That would be the orders to, for example, shut down the barbecue place in Toronto. It also can be orders against specific people to stop doing certain things. They can be other class orders. So for example, City of Toronto has a class order that says that if you are infected or if you've been around an infected person, you must quarantine for 2 weeks. And that's as a class. With respect to individual orders, those can be against one person. So for example, if you are supposed to be quarantined and you're not, the medical officer of health can make an order specifically against you that you must stay in your home. And it allows forced isolation, detention, where a person has been exposed to an infectious disease. Next slide. So we're going to be talking about the Long-Term Care Homes Act.
Oh, sorry, it didn't move.
So
My slides are moving. Just a second, sorry.
Yeah.
Sala, if you're still on, can you admit people? Because I'm having an issue running this slideshow and admitting people.
Yeah, yeah.
Okay, my slideshow is not moving. Just a moment, sorry. I'm just stopping the share. I'm gonna restart the share, okay?
Yeah. So we want to be on slide 10 when you come back.
Okay, the slideshow is not responding. Just one moment, sorry. Okay.
Jane, should we just keep going on and?
You want me to just keep going, or what do you want me to do, Natalie?
Yeah, if you just keep going on, I'm just gonna share right now.
Okay, so I'm on slide 10. So the Long-Term Care Homes Act has a fundamental principle, and that's the way that the act has to be enforced and how the act is interpreted. And that's that the long-term care home is primarily the home of the residents, and that it has to be operated so that it's a place of safety where they may live with dignity, security, safety, and comfort, and have their physical, psychological, social, spiritual, and cultural needs adequately met. So that's an overarching principle of that piece of legislation. The residents' rights also has a Bill of Rights, which has 27 rights. It's enforceable as a contract, and it guides the interpretation of the acts and regulations and any agreements between licensee and Crown, etc. So next slide. There's a few specific residents' rights that you should be aware of. So residents' right number 14, every resident has the right to communicate in confidence, receive visitors of his or her choice, and consult in private with any person without interference. So that's sort of that visitors thing. So the home is not entitled to interfere on its own right with visitors, all right? And that's going to be very important. The resident has a right to meet privately with their spouse or other person in a room that assures privacy. And again, that's this issue of privacy. We know there's been a lot of issues around confidence and privacy with people listening into conversations because they're, quote, supervising. Next slide. Resident number right number 5, the resident has the right to live in a safe and clean environment. Obviously that this is really important. However, many long-term care homes use this section to justify the restrictions that they're utilizing to say that, visitors coming in aren't safe and therefore we can't allow them in. And there's issues around whether or not that's applicable or not to that situation. Next slide. And as I said, it can be enforced as a contract, so you can sue a home for non-enforcement of those rights. And then the government sets out, that these regulations have to be promoted and respected. And there are things that the ministry enforces through their inspection process. Next slide.
So now we're moving into visitor restrictions in long-term care homes. So we'll go through the different directives and policies that the government's put out for long-term care during COVID. Next slide.
So sorry, can you just clarify, this is visitors as opposed to what they're considering essential caregivers, right?
So visitors and essential caregivers.
Okay, thank you.
Okay, so to date, there's 3 main documents that talk about visitor and caregiver requirements and restrictions. So we have Directive 3 from the Chief Medical Officer of Health. We have the Minister of Long-Term Care's Directive, and then we have a Ministry of Long-Term Care visiting policy, and they also have a number of FAQ documents, one talking about visiting and one talking about staff testing.
And an FAQ document is facts and questions.
Frequently asked questions. Yeah.
Frequently asked questions.
So the one thing with these, they're updated and amended quite frequently, and so it's very important to make sure you're looking at the most up-to-date versions. I think with Directive 3, it's probably been amended about 10 times or so since March. So they do constantly change. So we'll go into the first one. So this is Directive 3. This is the full title. I'll just refer to it as Directive 3. The newest version was issued on December the 7th. Next slide. So it was issued by the Chief Medical Officer of Health, which is Dr. David Williams, under the Health Protection and Promotion Act. And it provides direction to long-term care homes on a whole variety of issues. Talks about screening, admissions of new residents, and transfers and readmissions of residents, resident absences, visitors and essential visitors, limiting work locations of staff, staff and resident cohorting, so staff only providing care to, on a particular floor or a particular area of the home. Talks about what constitutes an outbreak in long-term care, the steps the home should be taking when there's an outbreak, and then communications. So I'll go into a bit of detail there. So the first thing Directive 3 says is that all long-term care homes have to have a visitor policy in place that complies with Directive 3 and is guided by the applicable policies. They also state that the homes have to comply with the minister's directive. So in terms of the home's visitor policy, these are the minimum requirements that all long-term care home visitor policies have to include. So you can sort of read that at your leisure, but basically covering, it's going to has to be flexible to change, has to cover education on PPE, so personal protective equipment, and infection prevention and control. Talks about allowances and limitations of indoor and outdoor visitors, screening, communication, anyway, yeah, so it's all there, yeah. So in terms of general visitors, so these are not the essential visitors or essential caregivers, but the general visitors, the long-term care home visitor policy has to include visits should be pre-arranged. Residents can have up to 2 general visitors at a time. The person must visit only the resident they're intending to and no other resident. If the visit's outdoors, they have to have a face covering. If they're indoors, they have to have a surgical mask on. And general visits are not permitted when a resident is self-isolating or symptomatic, a home is in outbreak, or the home is in an area of high community transmission. So most of Southern Ontario is in the gray zone right now. So general visits are not permitted in most long-term care homes.
I think it's not clear, but I think that because we're in lockdown now, I believe that everybody's in gray, but it's
okay.
But I think that's the way it's being interpreted.
Okay. Next slide.
Next one.
Okay, so yeah, so for essential visitors, the long-term care homes have to have a visitor policy that specifies essential visitors. So they define them as persons performing essential support services. So that's food delivery, an inspector, maintenance, or healthcare services, or a person visiting a very ill or palliative resident. They actually don't specifically mention designated caregivers in Directive 3. That's actually only in the Ministry of Long-Term Care visiting policy. They say for essential visitors, they have to have a mask or full PPE when providing direct care to a resident. And they're the only type of visitor allowed when a resident is self-isolating or symptomatic, a home is in outbreak, or in a region of higher community spread. So the last piece in Directive 3 dealing with visitors is the communication piece. We know that that's been a huge problem in long-term care. Directive 3 states that long-term care homes have to keep families informed of COVID, including outbreaks within the home. So the next directive is the Ministers of Long-Term Care's directive, which is specifically about home surveillance testing and access. The most recent version came into effect on January the 8th. So the Minister's directive includes specific requirements on testing for a number of different groups of people. So testing for staff, occasional entry, so that might be an agency nurse that's coming into work, caregivers and support workers, general visitors, persons who've previously been diagnosed with COVID, and then for palliative care and emergency situations. They also talk about access subject requirements. So what that basically means is no person should be entering a home unless they meet the requirements in the minister's directive. And then the last piece it talks about is statistical information. So stats that the home should be gathering on testing within the home that they may have to provide. Yeah. So in terms of staff, what the minister's directive says is that all long-term care homes shall ensure that staff, students, or volunteers take either the rapid antigen testing, so this is new, or PCR testing. That's probably what most people are familiar with. The rapid antigen testing, my understanding, it's not to be used to diagnose COVID. It's supposed to be used as a screening tool. And basically my understanding is that it's faster, the results come back faster. So for areas in gray, staff are supposed to be tested 2 to 3 times a week using the antigen testing, or if they're using the other test, the PCR test, it would be every 7 days. There is a caveat in that stating it's as close to the 7 days as can be reasonably achieved. So in terms of what the homes do, if a person, has, only has a test that's 8 days old as opposed to 7 days old, this seems to suggest that they may be able to let them in. In terms of caregivers and support workers, they have to demonstrate to the home that they've had a negative COVID test before they'll be granted entry. So for visits that are either indoors or outdoors. So for people in homes in the gray region, it has to be a negative test in the past week and verbally attest that they haven't subsequently tested positive, or they can have the negative antigen test, that rapid test, on the day of the visit.
So caregivers, what do you mean? Like those are the hired in private caregivers?
So caregivers are, so the essential caregivers. So they may be hired, they may be family members. Support workers generally would be, so maybe there's a doctor from the community that's coming in, or a nurse practitioner, that they're not staff of the home.
And then does this apply to agency staff? Just to clarify for everyone, like hired in.
So for agency staff, so they are in a different category. So they would be in the occasional entry category. So for that, it says that they have to ensure that those staff take an antigen test upon entry every time they enter the home, because they wouldn't be coming in every day.
Okay.
So it says every licensee shall ensure, again, that no person enters the home unless the requirements contained in this directive have been met. And then we move into the third and sort of final document, which is the Ministry of Long-Term Care's COVID-19 visiting policy. This was last updated and effective December the 26th. So this is sort of the main document where you're going to find a lot of the specific information about visiting for essential caregivers and general visitors. So the purpose, so it's intended to supplement Directive 3 and the Minister's Directive, and also support homes in implementing the directive. So it talks about the types of visitors, it's very clear that very clear that staff are not visitors. They talk about essential visitors. Here they include support workers. So again, could be community physicians, community nurses, as well as caregivers. And then the last one is general visitors. We'll go through in detail a bit more of this on the next slides. So caregivers, so they, in the visiting policy, it's very clear that a caregiver is a type of essential visitor. They're not just a general visitor. Could be a family member, could be privately hired caregiver, paid companion, or a translator. The designated caregiver is designated by the resident or their substitute decision maker in writing. So it's not the home that gets to decide who the person's designated caregiver is. It's actually up to the resident. And caregivers, so they're visiting to provide direct care. Direct care to the resident, it's interpreted very broadly. So it might be helping with feeding, mobility, hygiene, cognitive stimulation, communication. You have to be 18 years or older, and a person can have up to 2 designated caregivers per person, resident. In contrast, so the general visitors, they're not deemed essential visitors. They're assisting with the non-essential services like, social reasons, communication, cognitive stimulation. So visits for essential visitors, so it's subject to the direction from the local public health unit. So the local public health unit may tell the home, not to allow, essential visitors in at particular times, for example, depending on the situation going on in the home. So that caveat is there. So for homes in the gray region or in outbreak, so when a home is in outbreak, a person's allowed 1 caregiver per resident at a time. So they can still designate 2 caregivers, but they would only be able to come in 1 at a time.
And if they're not in outbreak, it's 2, right?
If they're not in outbreak or they're in a region of low community spread, so green or I think it's yellow, they could have 2 at a time. So for general visitors, it's again 2 general visitors per resident, again, subject to the discretion of the local public health unit, and provided the person's not self-isolating or symptomatic, the home is an outbreak, and the home is located in a region of low community spread. So that's why right now no general visitors are permitted in all the homes that are either in outbreak or are in the gray, the lockdown. So in addition to providing proof of a negative test, caregivers and general visitors also have to verbally attest to the home that in the last 14 days, they've not visited another resident who's self-isolating or symptomatic, or another long-term care home in outbreak. They're required to complete training, the home's training, so on PPE and hand washing and infection control, as well as retraining on that based on what the home's visitor policy is. And then they also have to verbally attest to reading the home's visitor policy and then rereading that policy at least once a month. For PPE for caregivers, the home is actually responsible for providing all PPE for essential caregivers. For general visitors, the home would only be responsible for providing a mask if it's an indoor visit. If it's an outdoor visit, the visitor can bring their own mask. The caveat to this is if the long-term care home does not have PPE, no visitors are to be permitted. So if a home says, we're not allowing essential caregivers in because we don't have PPE, I would, very much question that. The government says that there is PPE, homes just have to ask for it. So if your home, the home your family member is in is claiming, we don't have PPE, definitely would want to get more information about that, because they just need to ask and they should be able to get it. So in terms of managing safe visits, so for caregivers, the home is not allowed to schedule or restrict the length and frequency of visits. We see a lot of problems with this where homes do try and schedule visits. For general visitors, the home can restrict visiting, so they can schedule the visits. They can also limit the frequency and length of visits, and also determine where the visit will take place. So at minimum, visits have to be at least one visit per week per resident, and the visit has to be at least 30 minutes or longer. So supervising visits, again, another big issue we come across. Homes are not required to supervise. The visiting policy does give discretion to supervise for health and safety reasons. So it says monitoring the floor to ensure physical distancing or supporting the resident. Again, this shouldn't be like a blanket requirement within homes, but when in very limited circumstances where it may be required, and it has to respect the resident's Bill of Rights, which Dane talked about previously. So residents' right to communicate in confidence with visitors of his or her choice and consult in private. I think it would be a bit difficult to supervise, but also ensure privacy. So practically speaking, I think this is difficult to achieve. But anyway, the visiting policy does allow it. So non-adherence. So long-term care homes do have discretion to end a visit by a visitor who repeatedly fails to adhere to the home's visitor policies. But the home has to sort of take some action before they would get to that point. They have to have explained the requirements. They have to give the person sufficient resources to adhere. So, a home can't say, well, you're not physically distancing, but yet the person's in a room where that's not possible to physically distance. They have to show the person how to properly use PPE, as opposed to just saying, well, you're not using it properly, so we're ending your visit. And the visitor has to be given sufficient time to adhere to the requirements.
Just a note for the people who are asking questions in the chat, I will circle back to those questions when the presentation is done, and then we'll also open it up for questions generally. So don't worry about that. We will get to them. We're just going to get through the presentation first. And could everyone please mute your, just go to the bottom left of your screen. If you're not on mute already, can you just hit mute? Thank you. Thanks, Alyssa.
Yeah, no problem. So temporarily prohibiting a visitor. So again, I just want to emphasize it's temporary. So homes can temporarily prohibit a visitor who repeatedly is disregarding and not adhering to the home's visitor policies. Again, the home has to, this really would have to be sort of the end of the line. Really, they'd have to basically have exhausted all of the reasonable efforts to be able to sort of get to this point. So the next slide, and I think I'll turn it over to Jane here. So question, probably the most common question we get at ACE is, are the visitor restrictions legal?
Next slide.
So again, just for the people who joined late, we have the lawyers from the Advocacy Centre for the Elderly, ACE, who are giving a presentation on access for essential caregivers and visitors to long-term care homes. We're going to do the presentation and then open for questions and answers. And this is Jane Meadus and Alyssa Lane, and they're institutional advocates. They're lawyers at the Advocacy Centre for the Elderly.
And we are getting closer to the end of our slides, just in case you're worried. We do have significant concerns about the legality of the directives and visitor policies, and I should say policies, not polices, but I don't know, that might be a slip of the tongue, I don't know. In the way that they're being used, in the way that they're being enforced, and even just the legality of whether or not the government has the authority to do these restrictions in the way they are. Next. So we do question whether the Chief Medical Officer of Health has authority to restrict visitors and caregivers through a directive as opposed to an order. The Chief Medical Officer has authority to make directives, but those directives are to the home. And in our opinion, they are, the Chief Medical Officer of Health is using them very broadly in a way that we don't actually think is necessarily that all the sections are necessarily legal, and we think that a lot of them could be challenged. There had been, certainly in the spring, there were some challenges that started. I think that when they lifted some of the restrictions around visitors, that those court cases were probably withdrawn. But I wouldn't be surprised if we see some more, but we do think that they are open to be challenged in court. Because that's different than having an order. An order is something that's appealable to the Health Services Appeal Review Board. And so you can, if you don't like what's in the order, you can challenge it. And unfortunately, the directives aren't the same, and we think that they're overly broad. Also, a directive can't, in our opinion, override the Long-Term Care Homes Act because it's just a directive. And there's nothing in there that says that they can override, what's in the Long-Term Care Homes Act. So there's issues around that. But that it's easier said than done. So it's, we can say that it's, we don't think it's legal, but until someone challenges it in court, it's a very difficult thing to challenge. Next. So the minister's directive gives the Long-Term Care Homes Act, gives the minister authority to issue operational policy directives where it's in the public interest to do so. And it says that where there's a conflict between the minister's directive and another requirement under the Long-Term Care Homes Act, the Long-Term Care Homes Act prevails. So again, you have to, if there's something in one of the directives that you think is not in compliance with the act, that's something that certainly can be looked at as well on a legal basis. Next. The Ministry of Long-Term Care's visiting policies, it's unclear what legal authority is being used to issue and enforce some of these policies. So for example, having to be supervised, not being able to go certain places. Again, it seems to go contrary to what's in the Long-Term Care Homes Act about privacy and being able to meet with someone in a private area, for example. And so again, it's something that's a potentially open to be challenged in court. Next. There are issues around whether it's contrary to Section 7 and 15 of the Charter of Rights and Freedoms, as well as the Human Rights Code, as discrimination on the basis of family status and failure to accommodate. Then we come to common visiting issues in long-term care homes during the pandemic, and I think I'm going to turn that back to Alyssa.
Yeah. So these are some of the common complaints that we've heard since March. So homes prohibiting caregivers altogether or heavily restricting visits by caregivers. So long-term care homes falsely claiming that the local public health unit directed them to prohibit all designated caregivers, when in fact the local public health unit did not give that direction, and the home just went ahead and made that decision, and then told families that it was the public health unit that provided that direction. Requiring caregivers to be approved by the home. There's no approval required. You just have to submit something in writing to the home saying, you're the designated caregiver for the resident. And again, it can be up to 2. Requiring caregivers to specify what direct care they're going to be providing during the visit. Again, not required. Requiring caregivers to schedule their visits. Or only allowing them in on particular days. So for example, a home saying, the caregiver can only come in Monday to Friday, not on the weekends, and they can only come in at lunchtime for 1 hour. So again, the homes can't do that. Only allowing a resident to have 1 designated caregiver total, as opposed to 2. So you can designate 2, they just can only come 1 at a time. Telling caregivers they're only allowed to come in once a day because it takes too much PPE. Long-term care is requiring all visits by all caregivers be supervised. Again, it should be used in a very limited circumstance. Not allowing caregivers to provide direct care because they can't socially distance. So certainly, you try to socially distance, but when you're bathing somebody or helping them, clean them or feed them, you're not going to be able to socially distance. Not allowing caregivers to use the bathroom while they're at the home providing care. So we've had a lot of cases where caregivers are being told they have to go home, leave the home, use the bathroom at home, come back, go through screening, get all new PPE, and then they continue providing care to the person. Again, they should be designating a bathroom that caregivers can use while they're at the home providing care. Another big one is reprisal against residents or caregivers who raise concerns about the home's visiting policy not being compliant. We've had homes threaten to permanently ban caregivers because they're quote unquote difficult. Another big one is just a lack of communication from the home. So homes not notifying families of change in the resident's condition, not telling them that the home is actually an outbreak or their family member may have COVID, or not telling caregivers about the changes to the home's long-term care visitor policies, and then later getting upset with them when they're not complying with these policies.
So what can you do if there's a complaint, if you have a complaint? So there are complaint processes. And so anybody who's in long-term care probably knows that there's an internal process. You're never required to use that internal process. You can always go externally. Homes do have to investigate and report on complaints internally. And complaints in writing have been required to be provided to the ministry, although I'm not sure that that's happening right now during COVID. Do you know, Alyssa?
In terms of, sorry, what was the question?
Whether complaints have to be provided, complaints in writing are still provided to the ministry?
I would assume so. I think so. Yeah.
I think under Bill 195, that deregulation was continued. Actually.
It was? Okay, that's what I was trying to remember. It's hard to sometimes remember some of these things, and we write these slides all the time, so things change.
I think so.
Right,
anyway.
right. Yeah, I think you're right, Natalie. Yeah.
They're not being provided right at the moment. So anyone can make a complaint to the Ministry of Long-Term Care. And in fact, there's an obligation if you believe that there's been abuse or neglect, that you are obliged to provide it to the Ministry of Long-Term Care. The only exceptions to that are residents don't have to make any, report, and like a lawyer. So if a resident tells me about something or somebody tells me about something, obviously solicitor-client privilege is over that. But other than that, physicians, nurses, everything are supposed to be making complaints if they see potential neglect or abuse. Next, you can make a complaint to one of the regulated health professional colleges, but unfortunately support workers don't have one, so there's no body to complain to. And of course, many of the complaints are about them. Next slide. You can make a complaint to your local medical officer of health about various practices in the home. We do know that, there's been a lot of complaints about inaction by the Ministry of Health, the Ministry of Long-Term Care. They don't have the ability to fine homes, but they can issue orders, and they can have provincial offenses. For example, they can contact the police and have homes charged under provincial offenses if they're not complying. And that historically has not happened. The medical officer of health in, I believe it's York region, issued an order against a home, Villa Leonardo Gambin, to comply with directions related to Outbreak. And if they don't comply, I believe it's a $5,000 a day order fine. Don't know if it has actually been fined, but that's certainly an area. And I know that Alyssa and I sometimes call when we're told that a home will tell us, oh, we can't do this because it's that we've been told not to do it, or there's an order by the local public officer of health. We contact the local public officer of health, and I think to date we haven't actually found that any of these supposed orders are actually in place. That actually wasn't true.
Yeah.
Are we getting close?
Yeah. Yeah.
Okay.
You can also make complaints to the patient ombudsman. Those complaints must be in writing, and you can go to their website. Next slide. So I'm just going to do a really quick, like a couple of slides here, and just take 2 minutes on the issue of detention and absences. So next slide. So we have significant concern about the legality of the ongoing detention of residents of long-term care homes.
Can you just tell people what you mean by detention?
When I talk about detention, I'm talking about people either not being allowed out of their room or being allowed out of a home. So people are being, since March the 22nd, they've been told that they can't leave the home. So medical officers of health certainly can detain people under the Health Protection HPPA. And that's being done everywhere except for long-term care home, retirement homes, and congregate living for people with disabilities. So they're using proper orders, you know, for example, in places where there were migrant workers and they had to have people stay in place. They use a Section 22 order. Those orders are appealable. So if you don't agree, you can go to the board over that. However, for some reason, even though Doug Ford continues to say he has to comply with the law and he wants to follow the rules, they don't follow the rules with respect to this. Next. So since March the 22nd, home residents have been pretty much detained in the homes except for medically necessary appointments. There was a short period of time starting in September that they could go out when they wanted, as long as the home wasn't an outbreak. Then they changed it and said that certain people weren't allowed to go out at all. And in homes where people were allowed to go out, they still had to have permission of the home. And again, this is a problem. Next slide. Long-term care homes don't have a detention authority. Directives are not a way of detaining people because there's no appeal process and it contravenes charter. If you want more information about this, we do have a paper, an article that's going to be coming out in our newsletter, which should be on our website in about a week.
And the charter is the Charter of Rights.
Charter of Rights, sorry, yeah. Charter of Rights and Freedoms.
And there's actually another article in there talking about the visitor policies as well. So it should be up in about a week.
Next slide. And I just wanted to talk about medically necessary absences because we do get a lot of questions on this as well. So there's no requirement to prove necessity. So you don't have to prove that, you know, a person has a broken bone to have a medical appointment. We also say that they include, for example, dental or other kind of medical appointments. We've had issues of homes saying it's only if you go to see a doctor and nobody else. It can include an overnight visit. Long-term care home cannot deny the request. The resident is screened on return for, you know, cough, cold, temperature, all that. But if they do not require testing, they could be antigen tested perhaps when they come in. And there is no self-isolation. So we have a lot of cases where people are told that when they come back from their doctor's appointment, they have to isolate for 2 weeks, and that is entirely untrue. The home does have to provide a mask to the resident if tolerated and remind them about public health measures such as distancing and hygiene. Next.
So just a quick, under the new sort of scenario for screening, that where they're using the rapid antigen tests, which are just the nasal swabs, not the full nasal pharyngeal swabs. Is that the new screening? Like, so that can they be required to have the rapid antigen test? Do you know?
That I actually don't know.
So I looked it up and I've forgotten the answer now.
Okay, sorry to put you on the spot. Maybe when we get to the question.
Alyssa can look it up while we're finishing. So thank you very much. That's the end of the slides. You know, one of the things that we want to say is that if you are a visitor and you're going into a home, you know, you want to expect that the home will comply with the rules, and we want to encourage people to also comply. So, you know, things are different in homes. So if you're used to going out into the hallway and grabbing the, you know, a towel if you need it, or going to somewhere doing something, you know, comply with what the rules of the home are if you can. If you want to do something like walk someone up and down the hall because you don't want them to get blood clots, please speak to the home to ask how you can do that safely. You know, I think there's a lot of cooperation and communications that's required. And hopefully if people will do that, maybe things will go a little better than have been going in the past. So after that, we can turn to questions.
Yeah, so and just the minister doesn't have the ability to levy fines against the homes, but they actually do have, there is a law that was passed when Eric Hoskins was health minister that amended the Long-Term Care Homes Act, which enables the minister to have power to fine the homes and also suspend licenses as well as revoking license for non-compliance, right, with, you know, keeping the home safe and so on and so forth. It's passed the legislature. It just needs to be proclaimed by the Lieutenant Governor General, which is entirely in the Ford government's powers to do. And they haven't done that. So the power is there, but the Ford government is sitting on it and won't do it, just so people know. And there have been no fines levied, no licenses pulled.
They can pull licenses now. They don't need that, but there's no fining ability unless they pen, and those aren't fines, they're administrative monetary penalties. So they're based on whether or not they comply with orders.
Okay, so we can talk more about that as sort of a separate issue, but just wanted to flag that. Okay, so I'm looking through the, there's a whole, we have about half an hour for questions and answers. So I'm just going to go through, I'm going to do a few at a time, okay?
Yeah, I have, so I'm kind of ready.
Okay. Okay, so there's some discussion about the difference between retirement homes and long-term care homes. I'm not going to sort of get into that too much here. Where to get more information on how rapid testing, the rapid antigen tests, so those are different than the PCR tests that you probably have all been getting at this point. These are the, you know, the responses are back within a very short period of time, up to 24 hours. And they're the quicker swabs. So they just have a question about how to get more information on rapid testing and how it's required to be used in long-term care. Alyssa kind of went through that, but can you just review that? Yeah.
Yeah, so there is some documents, and I don't know if they're publicly available. That's one thing throughout this whole pandemic, actually getting the materials, the directives and the visitor policies in long-term care has been really tricky because there's no sort of common place to go. If you want to contact our office directly, I'm happy to provide them to you by email if you would like. That might be the
I'll
best
also put a spot up on our website with this presentation, just on the main slideshow across the top, and then links to all of those documents, the current version.
Oh, that's great. Okay, that might be easier. I can send them to you.
Yeah.
And then Alyssa sends them to us as they update. So we'll update them on the website. Sala will do that, and we'll keep them up to date on the website. So that'll be the directive number 3, the minister's orders, the other orders and directives and guidance and policy. Okay.
Yeah, and there's a difference, like Alyssa said, it's hard to, they're not publicly available. It's not that they're not public documents, they are public documents. It's just that the government has, it sort of picks and chooses what it puts on their website. So even though it may be a public document, it may not be, like, we get them because we have them sent to us and we have places like that. They just may not be easily available. And everyone complains about that, so.
Very hard to find them. Okay, I'm going to whip through some of these. Some of them are not really on visitors, so I'm just going to answer very quickly. When you say a long-term care home must always have a nurse on, does it apply to an RN or an RPN? So every home under the Act, under the Long-Term Care Homes Act, is supposed to have one RN 24/7, which is inadequate, of course. These are, you know, that applies to a 40-bed home or a 400-bed home. Under the emergency orders, when they passed the Emergency Act and carried over in the summer, even at the end of the emergency, they deregulated that standard, and homes are not required to have an RN 24/7, if you could believe it, in Covet. But that is but generally speaking, yes. Very bureaucratic, yes, it is. Do we have to be registered with the long-term care home as an essential worker? What do you mean as a caregiver? So as an essential caregiver, or is our power of attorney designation for care enough?
No,
so
you
it is not enough. Jane or Alyssa? Jane.
Yeah, so you'd have to actually submit something in writing to the home saying that you're the designated caregiver. You know, certainly, you know, as the substitute decision maker for the person, that's one thing, but in terms of actually going in, you'd have to just submit something to let them know.
And so if the resident is capable, they choose their essential caregivers. If they are not capable, the substitute decision maker chooses their 2 essential caregivers. And the home cannot
just because you have a power of attorney does not make you the decision maker. If the person's capable, they're the decision maker.
Right. That's
and there's lots of attorneys who can't go in because they're immunocompromised or live far away. So you do need that in writing, but all you have to do is, you know, say that you're coming in. You're one of the designated ones, or have the person designate you.
So it's the substitute decision maker or the resident, just to be very clear. Okay. So caregivers have been restricted on days for visits. Now, I think this is referring to retirement homes, but we're talking about long-term care homes, so we'll stick with that. Caregivers have been restricted on days for visits, so which days they can come, the length of time for the visit, and restricted to in-room visits only, and no taking the person to the dining room. Is this in accordance with all of these 3 levels of visitation rights?
So no, so the home shouldn't be restricting caregivers. They're actually not permitted to restrict the length, frequency, or duration of visits. They can determine, where the caregiver will provide care. So generally, a lot of times the homes will say the person has to provide care in the person's room. However, for things like mobility, that would be pretty difficult to help someone walk around, in their teeny tiny room. So we would recommend speaking with the home about how that can be safely done. I know group dining in a lot of homes is not happening right now. So a lot of people are eating in their rooms. And so, yeah, the homes may say that the caregivers can't be taking the senior to a dining room where there's going to be lots of other residents around.
Sorry, can I just interject here and clarify that? It is a caregiver whose mother can go to the dining room. There is dining room, but they don't allow this caregiver. She's the only caregiver that goes. The rest of the family's not going. So she's the only caregiver, and her mother wants to go to the dining room to see her friends, but they're saying she can't.
Yeah, so I think that's one they should probably talk to the home about, just because, again, it's tricky with them, being around other residents. I think a lot of homes would probably say no, but in terms of what the visitor
caregiver, of all the caregivers in the place.
Oh, all the other caregivers are allowed except her. Oh, okay, so that's a completely different situation. In terms of why they're, in terms of why the home is sort of singling that person out, that's an issue, absolutely.
So what I would say is that, I know some of the questions are around, what do you do if the home is, because part of the problem is that it's very difficult to challenge these issues. And so what you want to do is you want to challenge it on the basis of something that's in the legislation. So what I would say is that it's interference with a visit. So if the home is going sort of above and beyond what's allowed, so for example, let's say they're saying, well, no visitors can come in between the hours of 8 and 10 at night, or you're only allowed in once a day, or whatever it is. That's not what the government rule is. So I would make a complaint, for example, to the ministry and say that this is interference by the home with a visitor. And so if they're allowing everybody else in and not allowing that person in, that's how I would make that complaint.
Okay.
So you want to focus it in on the legislation.
Okay. Thank you. Okay, so for people who want copies of the documents, we'll put them up on our website. We'll also share them on the Facebook group as soon as tomorrow, likely. Okay, so there's a question about the vaccines. Will these directives and so on still apply once they've received the full vaccination regimen? So obviously the directives and so on are changing all the time. And they may change, and no one really knows how they may change. So that's just, I think, a very straightforward answer.
Yeah, it'll depend on, they change, sometimes. So it really will depend on how the vaccines are, how it rolls out, how things are happening. But it absolutely could change. It could be, like a vaccine passport, and it might not, who knows.
Okay, so 2 documents refer to verbal attestation. This is about tests. My mother's residents asked for proof and wanted a photocopy of a test result. So that has changed over the months. Do you want to, go ahead.
Yeah, so they can ask for proof of a negative test in the last week. And then it would be verbal attestation of not having visited another resident in another long-term care home that's in outbreak, or a resident who has symptoms or is self-isolating. So they can ask require proof right now.
So the proof is for the test. So they can require proof that you've had a negative COVID-19 test. And then a verbal attestation, which is not proof, it's just you swearing sort of that you have not been in contact with a person with COVID-19. Is that correct?
Symptoms and that sort of thing, yes.
Okay. Can long-term care homes apply stricture restrictions, as in only allowing one caregiver assigned to a resident for a period of time? And can they restrict caregiver access if they're from another municipality? So for example, like some municipalities, some areas are in lockdown, some are not. People may be crossing those lines to go to a home.
So that's such an issue right now because I think we're all on lockdown, but the answer is, again, our opinion is that if it interferes with the visit, they cannot make more restrictions. That's our interpretation. So again, that would be the complaint. That's how I would base the complaint. So if the home is saying, we're only going to let you have one caregiver assigned, or you can only like we've heard things like caregivers have to provide at least one of the following services in order to be approved. There's no approval process. There's not. So anything that's sort of outside of that, we would say no. If it's just a process thing, whereas they're saying, in order to be an essential visitor, we want you to write to the director of care and we want you to fill in this form. I think that's less of an issue. With respect to the outside of the area, my recollection is that there was actually some very specific documentation around that said that absolutely they cannot do that you can go out from area to area. Okay. That was my understanding. Alyssa, your recollection?
Yeah, and I guess the only other caveat would be if the local public health unit has instructed the home differently. So that's, again, there's that caveat there, but the home can't just unilaterally go in and implement those requirements.
And again, if they tell you that the local health department has said that no one from outside the area can come in, I would call your local public health and confirm that, because we have had lots of cases where we're told things that aren't true.
So the next question is, what happens if a home makes an accusation without proof that the caregiver behaved inappropriately and restricts their visits? So Alyssa described this. That's supposed to be a very last minute thing. They're supposed to try and resolve it with the person and beforehand. But so say they make the accusation that the caregiver behaved inappropriately and restricts their visits. What can that caregiver do in that circumstance?
Yeah, that's a really big problem. I'm seeing a lot of that with, basically anybody who is coming into the homes and saying, like, look, your visitor policy is not complying with the directives. Having homes basically come back and threaten the person that they're gonna not allow them to come in, or permanently sort of ban them from the home. So in that case, again, we don't think homes have any legal authority to do that. If you even look in the Ministry of Long-Term Care Visiting Policy, at the very most, so after all reasonable options have been exhausted, the home can only temporarily ban a visitor. And that would have to be, they're just flagrantly disregarding all the rules. The homes, explain to them, given the resources, given them time to try and understand it. So in that case, I would suggest that you likely would want to file a complaint with the Ministry of Long-Term Care about that.
And again, focus it into one of the pieces of legislation. Yeah. And it's going to depend on what the home says versus what you're saying and what the evidence is. But definitely I would make that complaint. There are certainly legal avenues that can be taken, but it's tough.
Mm-hmm. So, and to make that complaint, just can you remind people they can phone the ministry line, but they also can put it in writing, right? And it's better in writing?
No, not necessarily. It depends. I mean, you can put it in, if you put it in writing, I think you get more detail and you get more clarity sometimes. But for the ministry, it doesn't matter. For the patient ombudsman, it must be in writing.
Okay, so for the ministry, we'll put the phone number, the hotline number up on the website, and also where you send a written complaint to in those circumstances. And then, our experience is that, like in very serious incidents, they were getting back fairly quickly or sending in inspectors or what have you. But recently we've heard from people that are not being heard, like they're not hearing back at all.
No.
Is there
no.
anything people can do in those circumstances? Like, what do they do? Call ACE? Where
Yeah,
do they
so if you've made a complaint, you haven't heard back. So the first thing I would recommend is follow up with the ministry again. If they're still not doing anything, you could look at filing a complaint to the Ombudsman of Ontario. So that's the organization, they oversee the Ministry of Long-Term Care.
Okay. Okay, so from the National Pensioners Federation, interested in the human rights violation, I think you're referring to detention, and to talk more broadly about that. So I will follow up with Trish McAuliffe, who's the president of the National Pensioners Federation, about that for a discussion, and maybe we can talk separately about that as well. Can we talk about rights as regarding window visits? Someone is asking.
So
And are they, yeah, I guess it's.
I don't think there is a right to a window visit. Again, it's sort of one of those things that isn't governed by any of the legislation or any of the rules that I'm aware of. And so you're really at the mercy of the home as to whether or not they're going to bring someone to a window, I think. And that's quite problematic. But there certainly is a requirement for them to try to socialize and try to, include families. So if that's the way they do it, whether it's window visits or iPads or something, they should be trying something.
They should be, sorry, what was the last couple of words?
They should be trying to get some kind of communication with families, whether it's iPad or window visits, but it's not something that's specifically spoken to that I'm aware of any of the policies, certainly not in the legislation, of course.
Okay, so the Bill of Rights though does kind of protect, right? Like they have to provide some kind of way of communicating? Like if they're not allowed to interfere with—
unusual situation, it's not really something that's in there. I think that I would argue that it was, you'd have to sort of think about how to pursue that, because it's nothing specific in there. It's more, it's one of those things where it makes sense, but the question is the right to have a visitor is sort of a passive right, because normally in a normal day, it means somebody showing up at the home and coming in and visiting, right? Doesn't really require the home to do anything. Whereas now we're requiring the home to do an extra step. And the question is it something that we can require them to do under the legislation? So it's certainly something that we'd have to look at.
Okay.
I have a question, but I'm not quite sure how to click.
Sparky, can I just get through this list? Because there's a whole—
yeah, no problem, Nat.
a bunch from you.
Yeah.
So sorry, thanks, hon. Sorry.
No worries.
Someone asked about what the website address is. So it's OntarioHealthCoalition.ca. OntarioHealthCoalition.ca, all one word. Okay. When it comes to 2 essential caregivers being listed, some homes are not allowing it to be switched up. So how do you change your 2 essential caregivers? So obviously we already clarified that it is the resident or their substitute decision maker who determines who the 2 essential caregivers are. Those are the only people that can do that, not the home. And then if you want to change it, or the resident wants to change it, or you're the substitute decision maker, how do you do that?
Yep. So you just, you may have to change it for a whole variety of reasons. Maybe the resident's care needs have changed. Maybe the caregiver is no longer available. And so you need someone else to step in. You're allowed to change it. You would just submit it in something in writing saying, I'm taking over now as one of the caregivers.
And so that would have to come from the resident if they're capable, or their substitute.
Yeah.
What I would say though is that if you're trying to switch it up so that you have 2 today and then tomorrow you add an extra one so that you can do 3 or 4 people, that's going to be a problem if you're switching back and forth. But if there's a change, that's not a problem. I think there was another part to that question which had to do with getting information about the resident, and that's different. Information is governed by the visitor portions that's governed by personal health information. So under the Personal Health Information Protection Act, information is protected unless the person or their substitute decision maker specifically gives consent for information to be given out. So if, for example, in this question, daughter, granddaughter, if the attorney wants if the person's incapable and the attorney wants the daughter or granddaughter to get information, they can advise the home. That's separate and apart from anything to do with visitors. Information's different.
Okay, sorry, you jumped ahead a question. So that was
Oh,
just clarifying how people get information. There was another part to that one, which is how can like if the resident has dementia, so they don't have capacity, they're not capable, and the power of attorney is an elderly wife, so I'm gathering then is not the substitute decision maker, but has power of attorney, what do? They can't, the daughter, granddaughter can't visit or get any info on the resident.
So the attorney makes the appointment, so they can appoint, sorry, if the person's not capable, then the attorney can appoint the daughter and granddaughter as the visitors.
The power of attorney, she means, yeah.
No, the attorney is the name of the person.
Yeah.
The power of attorney is the document, the attorney is the person.
Okay, so that person.
The attorney, so the elderly wife could appoint her daughter and granddaughter as the visitors if she doesn't want to visit. If the elderly wife is visiting, she can appoint one of them. So herself, and then she appoints one of the other two. With respect to getting information, that's what I was saying is a separate issue. Information is nothing to do with visits. Information about the resident. So if they want to be able to phone and get information, that they can do, and that's not restricted to two people. The attorney can phone and say, please provide information to my daughter and granddaughter, but they would have to consent to that.
Okay. And just to be clear, when Jane is saying the attorney, she's not talking about the lawyer. It's the person who has the power of attorney, right? That like
Lawyers and Ontario attorneys. Attorneys are, the attorney is the name of the person who holds the power of attorney for property or personal care.
Okay, just wanting to translate. Okay, so okay, sorry, I got lost. Okay, sorry. I just, for some reason, it just went way down.
So I think it says homes are declining, that one?
Yeah,
So
homes.
So homes are declining essential caregivers because of the inability to keep 6 feet apart when there are 4 in a room, using that as a rationale to keeping people out. That would not be a reasonable way of doing it. So if the caregivers are supposed to be coming in wearing protective equipment and all of that, and so they should be following proper infection control protocols, so it shouldn't be an issue.
And there also shouldn't be 4 people in a room. So right now homes are being told there used to be 3 and 4 residents per room. They're being told to move it to only 1 and 2. So that's another concern I have here.
Well, yeah, but it's got to happen over time, of course, and so that's
Right.
Going to take time. But the answer should be that they should take steps to ensure that the caregivers come in. There's nothing in the rules that say if you're in a 4-bedroom, you can't have a caregiver. And in fact, that would be contrary to what the rules are. So that would be definitely something I would complain to the ministry about. I think that's a big problem. And if continues to be an issue for someone, you can contact our office.
Okay, so we've talked about how to get designated as an essential caregiver and if the home doesn't do that. So if homes are not sort of allowing you to be designated as an essential caregiver, we were clear, I think, all the way through, but they're not allowed to tell you that you cannot be. The home is not the person that sets who the essential caregivers are. It is the resident or the substitute decision maker. If they're violating that, then you can make a complaint to the ministry. If they're not responding, then you can follow up on that complaint. And then if they still don't respond, sorry, what's the next level of recourse?
Then you can go to the Ombudsman of Ontario.
Okay. Now there's one question about is the whole province considered in lockdown? Does that mean that everything in the directives and so on that refers to being in a gray zone or what have you now applies to the whole province?
I think it does.
Okay.
That's my understanding. They haven't been particularly clear. It's been quite difficult to find out some of this stuff. So for example, Doug Ford today that he couldn't understand why people, you know, didn't understand what stay-at-home meant. I've read the regulations, I've read the orders that he's put out, and nothing in there says stay at home. So again, what they sometimes say and what actually happens and what's publicly available can be a bit confusing.
Okay.
I think there was a question, I just wanted to just jump back because there was a question about seniors residents, and I think what you're talking about is a retirement home. So retirement homes also have restrictions around visitors, and they are very different. However, you're lucky because the Retirement Home Regulatory Authority, the RHRA, has a website and it's well kept and it has all the material there. So if you're interested and you want to know what the rules are for the retirement home sector, go to that website and you will be able to find those documents. And they are different rules. There's different rules about PPE, who can come and go, masking, it's very different.
Okay, so we'll put that link for the Retirement Homes Regulatory Authority, that's what it's called, up on the same part of our website that all of this is on, with the video and so on, okay? Okay, so I'm just gonna stick, because we're down to about 5 minutes left, so I'm just trying to stick to the questions around visiting. I see there's a bunch of questions around vaccines and so on, and maybe we should do a separate Zoom specifically around the vaccine program and so on, and we'll need to get some different kind of experts on about that. But for this, I'm going to stick with visiting, okay, getting in to see and so on. I
saw one question about someone saying that people were designated on admission, and therefore they weren't on that list, so they couldn't be in. If that person, like it says they've been designated previously by the father and lawyer, I assume that means they're the attorney for personal care. If they're not the attorney for personal care, there cannot be such a designation. So it may be that what they think is a designation is not one. But if they are the attorney and the person is incapable, the fact the person has dementia does not mean they're incapable. But if that person is not capable of making a determination as to who visits, and that's one of the problems is there's actually no such thing as capacity to consent to visitors. It's sort of a bit of a weird area. So this is, again, it's kind of an odd thing to put in legislation when it's not actually a thing in law. But just presuming the person has dementia and can't make those designations themselves, if the person's the attorney or if they're the substitute decision maker under the Healthcare Consent Act, then you can sort of presume that you would be the decision maker with respect to designating essential visitors, although the law isn't altogether clear, but that's how it's sort of rolling right now.
Okay. Okay, thanks. I'm gonna run through really quickly now because we just have a few minutes left. Someone was told that they couldn't hire a person from a red zone. I'm presuming that's like a hire in caregiver helper. Is that true or no?
No.
Nope, not true. Okay, so this is another problem, right? People are not getting bathing, like their shower or their bath, they're getting sponge baths. Someone is asking, can they be forced to do sponge bath only when they're in an outbreak? They're supposed to have like 2 baths a week, right?
So,
2 baths or showers.
Okay, so I'm dealing with that complaint right now. I'm waiting. I have an urgent complaint to the ministry on that and a couple of other things around meals. So I'm actually waiting to see what the ministry is going to do. This is a complaint that we've had ongoing. And in the spring, I was told that outbreaks did not prevent people from having baths and showers. But I do have a specific complaint right now, so I can't tell you. My opinion is yes, they have to have them, and bed baths are not sufficient, but we'll wait to see what happens with the ministry. And then once the ministry decides, we'll decide where to go from there with that. I don't have the full answer because I'm waiting.
Okay, so we'll let you know because this is we're hearing this, people going, 6 weeks without an actual bath or shower. It's appalling, right? So we'll let you know as soon as we know. Now, this is a person who's being singled out, not being allowed to socialize with other residents. The family's asked for reports regarding incidents. They haven't been given anything, but that the home is not allowing their father to socialize with other residents. So what, is that okay? Are they allowed to do that? Obviously not, but unless there's something else happening that they're not telling you. What does a person do in that circumstance?
Call us.
Call the Advocacy Center for the Elderly. Okay, so we'll put
One of the questions that, unless we would really have to know the details of what's going on before we could really provide advice on that. So
okay.
that's one of those things, but please feel free to call us, call our office. We do have a 1-800 number for people who are out of town. So, and those will be posted by Natalie as well.
Yeah.
She can tell you where to see that.
Oh, I see there was one we missed about residents being locked in their rooms, and should the family call the police?
Yes. So, sorry, go ahead, Alyssa.
If they're physically locked in, I would say yes, that would be a fire code issue. But
But also, just as a human rights issue, like,
that's
Yeah.
the whole thing about detention that we're having issues with right now.
so if the police won't come because, you know, sorry, what are you saying, Jane?
Well, they probably, if you're calling the police because your family member isn't being allowed out of their room, as opposed to actually being physically locked in the room. But if they're not being allowed out, the police will probably come and say, well, that's the rules. And so it's unlikely they're going to do anything. We do think it is illegal detention, even under COVID, because there are no orders.
So what do people do in that circumstance?
If they're very concerned, they can call our office.
Okay. Okay, so there's, again, all kinds of questions about what's happening, you know, what changes with the vaccinations and so on. At this point, the directives and so on are the directives. They don't change. Even if the home is vaccinated, they are what's there. They may change, but that is not the case yet, okay? So can a resident be taken out of the home during an outbreak for a length of time, and how long before the resident loses their room?
So at the moment, I believe they can't go out on temporary absences. You can remove the person from the home, so you can actually withdraw them from the home and care for them at home. At some point in the future, if you can no longer do that, you can request a readmission, and they go to like a top of a high on a list ahead of most people. But you can't at the moment take anybody home because I think we're all on lockdown. There is the ability, if we weren't all on lockdown, if it was a green or yellow, you could take them home. I think it's up to 2 weeks, I believe, right now at a time. Anyway, you can take them home. I'm not sure on the time period because there is time periods under the legislation, and then there's COVID time periods, but they would definitely have to, it may be longer than 2 weeks, but they do have to quarantine when they come back. So most people weren't doing it because it was just, they didn't want to have to go into quarantine for 2 weeks when they came home, but you can remove a person from the home in the home. We've run into several cases where the homes have tried to prevent people from removing their family members from the home, like actually take them home forever. And the home said, no, we're not going to allow that. And that they can't do that they can't do that. Okay.
And then this is the last one, and other than sort of comments and thank yous, and we are at 7 o'clock. So I'll finish up with just how we can move forward, because clearly there's a lot of questions about a lot of issues. And I think this is helpful, but just for the last question here, does the Ministry of Health or Long-Term Care keep report on or keep records on complaints regarding visitors?
Well, so the answer to that is that all complaints that are inspected on, so if you make a complaint, eventually it should be inspected on. This is a
complaint specifically regarding a visitor.
Yeah, so yeah,
okay.
You mean that the visitor is complaining about not being able to get in?
I think they're meaning, I'm not sure. Mary Catherine McCarthy, can you clarify? Mary Catherine, are you here?
Yes, I'm here. Sorry. Yes, I was wondering if complaints regarding it's more from visitors being refused access, or
okay.
I guess that would be the main one.
Okay. So if you make a complaint to the ministry, those are all, of course, logged. and the ministry has to keep records of all that. All complaints have to be investigated in some way. There's very few instances when they wouldn't be investigated. And so those would be in a compliance report. But if, let's just say they looked at the home and they said they didn't find any non-compliances, they said that the home complied with all the rules, the report would just say what they looked at. So if you looked at it, you could see that they looked at visitors, but it would just say no findings. That would be it. So they wouldn't say what happened or anything. They only sort of list out what happened and comment on it if they make a finding.
Thank
Okay.
you.
So I just want to thank everybody for being here and for participating. I hope you found this helpful. I know it's a lot of information. So I'll work with Sandra and we'll post on the Facebook page for the advocates for long-term care reform. We'll post, you know, what we can there, the video and a bunch of links. And then, but we'll also just put it on the Ontario Health Coalition website. At the top, you'll see there's a kind of slideshow with big pictures. So we'll make one specifically for this session, and then you can click on it and you'll be able to get the video with the questions and answers and all of those documents, the links to those documents and things that we talked about, and the phone numbers and so on. So I'll keep an eye out, and I see that there's a lot of questions about the vaccine and, you know, what happens with the rollout of the vaccine and so on. We'll try and organize something fairly quickly for people to be able to ask their questions about that. And I'll post that again on the Facebook page and also on, you know, our Facebook at the Health Coalition and so on, so that you have a way of joining if you're interested. And so just thank you very, very much, everybody. I hope that was helpful, and I hope it answered some of the questions that I've been seeing flying around on the Facebook. So thank you. And thank you, special thank you to Jane and Alyssa. And you are amazing. Thank you for all of your help, all of this time.